Prostate cancer is one of the most commonly diagnosed cancers in men, affecting up to 1 out of 6 men in their lifetime. Early detection and appropriate treatment is one of the best tools for fighting prostate cancer mortality. We're happy to offer a new technology, the first site in Tennessee, to obtain an MRI to look at the prostate lesions, potentially to diagnose cancer. We then fuse those MRI images with an ultrasound in real time in the office to obtain appropriate targeted biopsies of those lesions. The fusion biopsy can enable us to detect cancer more accurately and enable better prediction of treatment outcomes. We first obtain an MRI of the prostate to look for lesions that are abnormal. We then use those lesions, which are marked in 3D on the MRI images, and fuse them with an ultrasound that is obtained live in the surgery center. With that fused image, we then biopsy the lesions. Active surveillance is one of the newest techniques for managing prostate cancer so that prostate cancer treatments are more tailored to the individual patient. Having an appropriate biopsy of a prostate cancer lesion enables us to better predict active surveillance outcomes. MRI fusion biopsy may enable us to better identify men for active surveillance that could avoid immediate treatment. Initially, MRI fusion biopsies are directed for men who are at high risk, who've had previous PSA blood test elevations, or men who are on active surveillance programs for prostate cancer. MRI fusion biopsy may become the standard of care in the near future as more and more centers are able to incorporate it in prostate cancer detection.
Family doctor has been monitoring my PSA for the past 6 or 7 years, and over that period of time it has gradually risen, and about 2 years ago he recommended Dr. Morris and Urology Associates to start monitoring it. And you know, we monitored it for 6 months, and then we did a biopsy, and we were at the watch and wait stage. And then after that, the new technology came online, and it was very beneficial to me that we found that the cancer has become more aggressive, and you know, we're now treating that in a more aggressive way.
MRI fusion biopsy improves peace of mind because we have an actual snapshot of the prostate cancer and a more appropriate staging and risk stratification.
The MRI biopsy was no more painful, no more stressful than the first biopsy. It was quick, in and out, over with. There was no pain, there was no side effects, no problems with it at all.
The procedure is completed under anesthesia or sedation and takes approximately 15 to 30 minutes. MRI fusion biopsy is covered by insurance, almost the exact same as needle biopsies are done currently. MRI fusion is obtained with 2 separate visits, an MRI visit and then an ultrasound-guided biopsy visit. With the MRI fusion biopsy, we obtain a standard 12-core biopsy of the prostate, which is standard of care, and then in addition obtain targeted biopsies of the lesions marked on the MRI. We feel that the MRI fusion biopsy is cutting edge because it enables a more accurate staging initially, may avoid unnecessary procedures down the road, and may avoid anxiety as patients have to continue to watch their PSA numbers rise over time.
This is a wave of the future, and I see this new technology as saving thousands of lives. I feel like it has probably, if not saved my life, it helped me a whole lot. You know, I'm very thankful for Dr. Morris and Urology Associates for having this technology, so I do highly recommend them.